Part 1 of this video series presented a new taxonomy on population health, consisting of 4 different cohorts, each requiring different management strategies. Part 2 of this video series targeted the first 2 cohorts, the healthy majority and the asymptomatic early chronic disease cohort. This segment of the video series is going to target the last 2 cohorts, the full onset chronic disease cohort and those patients that have complex episodes. Traditional managed care approaches have not targeted the full onset chronic disease cohort. However, when you look at this population, they spend nearly 8 times as much as those patients that are in the early phases of a chronic disease. UHC's research analysis have identified significant variation in how the full onset chronic disease cohort is being treated. And we have quantified that nearly 20 to 30% savings could be realized through better management of this particular cohort. An effective management strategy targeting this cohort of the population needs to be multidisciplinary and multi-specialty in nature. It needs to target not only the clinical, but also the social needs of this population. Beyond the physicians, pharmacists, social workers, palliative care specialists need to be involved as part of the care team to help in managing this population. The 4th cohort we have defined as those patients that have complex illnesses, such as cancers and strokes. These individuals are very sick and require significant healthcare services in a given year. In fact, through our research analysis, it is not uncommon for this segment of the population to be spending more than $100,000 per person per year to take care of their healthcare needs. Our traditional managed care approaches targeting this segment of the population have focused around a centers of excellence model. However, this model has not been effective in really controlling utilization, particularly around the end-of-life spending that occurs in this segment of the population. A more effective management strategy targeting complex episodes needs to involve multidisciplinary specialists, not only the clinical specialists, but also social workers, palliative care specialists, pharmacists, to manage the complex needs of this patient population. To learn more about UHC's population health taxonomy, please tune in for Part 1 and Part 2 of this video series.